Welcome, viewers. Welcome you all to our show, Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance to each other, and definitely by gathering knowledge. With this point of view, we have started our program, Orthopedic Solution Academy. And today, our topic is the magic of Ilizarov. And we will discuss about the ABCs of osteosynthesis by Ilizarov and the apparatus. And our honorable speaker is Professor Novikov from Russian Institute of Ilizarov from Russia. Uh, I would like to welcome Professor Novikov, sir, to our show, Orthopedic Solution. Professor Novikov, sir, welcome to our show.
Thank you very much. Good afternoon, all of you. And let me a little bit explain about our methods.
Sir, I would like to welcome our academic expert, Professor Mofakharul Barisa. Then we will start our presentation. Now, I would like to request our honorable academic expert, that is the very renowned orthopedic surgeon as well as the pioneer Ilizarov surgeon in Bangladesh, Professor Mofakharul Barisa. I would like to request Professor Mofakharul Barisa to join with us. Welcome, sir.
Yes, thank you. Thank you, Tanveer. Thank you very much. So I'm with you all the time. And thank you, Novikov also.
It's a great honor for me to be in the same screen with Professor Mofakharul Barisa and Professor Novikov, sir. Dear viewers, we try to discuss some important topic regarding our orthopedic subject. From this program, definitely we will gather some knowledge and we will implement that knowledge to our practical life. And now I would like to request our honorable speaker, Professor Novikov, sir, to start his presentation. And our topic is ABCs of osteosynthesis by Ilizarov and apparatus. Professor Novikov, sir, would you please start your presentation, please?
Thank you very much again. Let me Как это убрать? Can I start?
Yes, sir, definitely.
Because just now, you see?
Yes, sir. We can see you clearly and we can hear you loudly.
Thank you again. And this year, we will celebrate 100 years since Ilizarov birth, great surgeon, how we can say, Michelangelo of orthopedics, 70 years of his methods and 50 years of Ilizarov Center in Russia, in Kurgan. Let me a few minutes explain about information which I took from Wikipedia. What is it? Ilizarov. The Ilizarov apparatus is a type of external fixation used in orthopedic surgery to lengthen or reshape limb bones. Is a limb sparing technique to treat complex and open bone fracture and in case of infected non-union of bone that are not amenable with other technique. It is named after the orthopedic surgeon Gavril Abramovich Ilizarov from the Soviet Union who pioneered the technique. So many years ago, he used first time his magic frame. The technique gained fame across the Soviet Union when he successfully treated Soviet world record holder and gold medalist high jumper Valery Brumel in 1968. Brumel broke his tibia in a motorcycle accident and had more than 20 unsuccessful operations. over a 3 years period to try to repair his non-union. Ilizarov used distraction osteogenesis to halt the non-union and 3.5 centimeters leg length discrepancy. Then Ilizarov gained more fame in 1980 when he successfully treated Italian journalist and adventurer Carla Mauri. Mauri had broken his leg in a ski accident 10 years earlier, and his tibia never properly healed. When he was on an expedition across the Atlantic, the wound on his leg repainted, and a Russian doctor advised him to see Ilizarov. When Mauri returned to Italy after his treatment, Italian doctors were impressed that his tibial non-union was repaired. They invited Ilizarov to speak at the Italian EO conference in Bellagio. This was the first time Ilizarov spoke outside of the Iron Curtain, and from this data we can say Ilizarov opened new epoch in orthopedics. The technique was brought to the USA in 1987 by Viktor Frankl, president of Hospital for Joint Disease, and Dr. Stuart Green, who in 1992 edited the first English translation of Ilizarov's books. And now I can say Ilizarov, like the man, the myth, and the methods, in orthopedic inspiration and miracle of this nature. To perform the treated properly and successfully, one mostly know the methods as well as the apparatus. Many years ago, Oliver Barrett says, this frame provides happy balance between elasticity and stability, and its biomechanical factors adapted to bones allow to achieve amazing recovery. Now, more than 1,000 different external fixator doctors use all over the world. But this is only apparatus, nothing more. Just now, we want to start to talk about Ilizarov methods. And set of Ilizarov, I cannot say what is it Ilizarov frame. Ilizarov device, this is set of apparatus for the Ilizarov device is constantly being improved. It consists in 5 main groups of parts. First part we call details of supporting structures. Second part, bone fixing part. And third part, fasteners. Fourth, connecting parts. And fifth, auxiliary part. First group, details of supporting structure. This is ring, half ring, support 587 rings, arch, sector of arch. All support structure can be made of metal or composite materials. Semi-rings allow you to design closed and unclosed support. The ring-shaped support can be either solid or prefabricated. The ring-shaped support can be either solid or prefabricated. So many different shapes with open ring, open support, half rings, full rings, omega rings, sector of rings, combine of different assembled from
Not moving the screen.
Dear viewers, there may be some network problem, so that we're facing some problems by moving our screen. Professor Novikov, sir, can you hear me, sir? I think he's out of our network. He told us it is very cold there, sir, so it is very difficult to get the proper network from Russia to Bangladesh. Sir, I would like to request Professor Mafakar Bari, sir, to continue regarding the rings of Ilizarov. Sir, would you please say something about the rings during this moment of time?
Oh. 1 minute. So you're disconnected, Novikov. Oh, we cannot hear you. You're disconnected. Please try again. We cannot see you. You start again. No. You start from the apparatus. Okay, start. Okay, just now. Thank you, dear viewers. Professor Novikov was talking regarding the apparatus. Gabriel Abramovich Ilizarov was always fond of saying, no surgeon is justified to do any reconstructive surgery by Ilizarov technique unless he has got the competent idea regarding the apparatus and the technique, methodology. You must know before starting the Ilizarov. Sorry. Hello. We just. So many people help me and. Regarding the apparatus, he's trying, Professor Novikov is trying to connect. Okay. So before doing any Ilizarov surgery, orthopedic surgeon, Ilizarov surgeon, they must know about the details of the apparatus. Without knowing the apparatus, and you cannot apply the Ilizarov. Whenever you are in the OT, operation theater, you must have different parts of the Ilizarov apparatus. Novikov already told that more than 1,000 variations of the apparatus. And this apparatus gives you thinking in your brain whenever you are applying how to apply the different parts of the body depending on the case of the apparatus. Now Novikov is here, is going to talk.
Very
Yes,
far
sir.
Russia from Bangladesh.
Not Russia, Kurgan. Kurgan. Kurgan distance from Moscow to Kurgan is Dhaka to Kuala Lumpur.
Oh,
just now,
it's
very
a long distance. Sir.
Long distance.
Very strong wind and disturb us.
Yes, we can see you now. You start, please.
Start again? Or from
No. From the 5/8 ring, half ring.
Okay. And we have different material for
sir, please share your screen, sir. Share your screen with us.
Screen.
But just a moment.
Your PowerPoint presentation screen share with us.
Он не видит. Нет, он видит. Может быть, сюда? А вот эти? Да. Ну, давай. Very sorry.
It's okay, sir. No problem.
But I think during this year we will to do everything perfect after 2-3 times.
No problem. So it will be okay. Hope you will be fine
But
with this network problem. Yeah.
very sorry. We cannot. Do you see?
No, sir. Yet not we cannot see you, sir. Or see your
Cannot.
screen.
See you, but no screen.
No screen, sir. No screen. Just share your laptop screen with us as before.
No.
Your PowerPoint presentation.
Потому что в прошлый раз мы все общались друг с другом. Да, мы всех видели, и вот здесь шла презентация. Может быть, это? Вот сюда нажми.
Yes.
Only like this?
Yes, yes. You go on, quick.
Oof.
No, sir.
We have time, yeah. Or haven't time, no.
Sir, yet not. Yes, now just make it full screen, sir. Yes.
Only like that we can.
Okay, okay.
You cannot see.
We can see, yes.
We can see, but partly, sir, not the full screen. Just pull the screen to your right side.
Где-то справа. On the right side.
Yes, yes, okay now.
Okay, now, so yeah, you can continue like this. Okay.
Okay, we can continue it, yeah?
Yeah.
Yes,
And
sir.
second group of set of Ilizarov apparatus. This is bone fixing part. This Kirchner wires, diameter 1.5 millimeters and 1.8. This is depend of patient, child or adult patient. Diameter tips usually for metaphysis and epimetaphysis we use trocar, cancellous bone, and bayonet for diaphysis part of bone. And advantages of wire: tension it, act like a rigid pin. And this is special wires with stopper, with a leaf, types of stopper for correction, for translation, very useful pins. And bone fixing part, like half pin, we usually use the proximal part of femur and proximal part of humerus. Remember about diameter of half pins. And just now we start talk about third group, like clamps. This is bolt nuts, different size of bolt and nuts. And this we call universal bolts, when we can use both of end of bolts, end of threaded and whole of threaded. And same, I can say universal bolts give more possibilities for construction. Fixing wire fixator bolts with different design, slotted and hole bolts. This is depend of place of wires. When wire pass across of the center of hole, we use wire fixator with cannulated. When wire pass near the edge of the hole, we use bolt with slotted. Fourth part of apparatus, joints element, connecting part. This is treated rods and telescopic rods. Rods with groove and hole for fix the wires. Special implementer for proximal femur. And with this joint element, we load transfer to medial aspect for distal rings. And fifth, auxiliary parts that extend the design capabilities of the device and provide its functional task. This is brackets, washers with slot, radio screw, plates, bushes, complaint, Supremax nuts. I call this part like saffron, because very effective and very easy, very variable when you will use these simple and very effective details. You can see how we can fix wires during the surgery, how we can apply, how job, hinges, and another details from Zafran. This is washes, flat washes, plain washes, slotted washes, and conical washers. Sometimes we call Italian washes. This is a photo I took from Professor Shevtsov, and you can see how we can fix ring without any hinge in connecting non-parallel ring. Plates give us freedom for connect arch and ring with different size. Long connection plates very common, we use with defects and bone transfer. Treated coupling, in Russia we call Supremax. It is a high hexagon nut and is used for connecting rods with a solid treated. Like that. Bushing, there are bushings with 1 and 2 threaded cross hole, and give us support for connecting half ring, for connecting some rods. Curved plates, usually we use on the proximal part of humerus or radius. Long connection plates with or without threaded ends, usually we use for correction deformity and bone transfer. Another variant for connection when we use plates or twist plates. And all of these Zafran details give us possibilities fix wire with any position, with any angle. And just now coming time for principle of wire insertion, because of knowledge of the cross sectional of anatomy must be followed. And when we pass wire, start wires on the side with critical structure. must be used alcohol or saline to cool of sharp end of wire. Push wire only till two bone. Drill one cortex, then another cortex, and with hammer go out. When we pass wire, only with low speed drilling. And avoid impalement of tenderness, avoid transfixation, synovium, penetrate muscles. And when inserting near the joint, must maximum range of motion. For example, like here. And another principle of wire insertion, this is one wire, one hole. Multi-drilling. Remember about joint, and if we pass wire near the ankle joint, dorsiflexion before inserting posterior wire passage and plantar flexion before wire comes out of from anterior side. Another principle of wire insertion, wire should not be brought down to ring by bending it. Ring should be brought up to the wire. And wire should be placed on the top and bottom of each ring. And this gives us better stability. Another, during the surgery, avoid tourniquet to each bone segment. When we pass crosswire, this gives us chance to take good stability frame with osteoporosis. Hinges give us possibilities with wire with any direction. Hinges post give us chance fixation with any angle, with any position on the frame. Half pin if we want to fix proximal part of femur or proximal part of humerus. Usually we use chance pins with some different fixator. So many variants for fixation of half pins. This is depend of knowledge and opinions, experience of surgeon. Another situation when we need selection ring size, very easy and very quickly with finger. And remember about soft tissue, minimum 2 finger or minimum 2-3 centimeters between skin and frame. Any place, any segment. Now variant of different details, combine different details during the osteosynthesis. And impossible to do surgery without additional details. We call in Russia ключ, in Bangladesh wrench. So many different design, number 10 millimeters wrenches, and without tensioner, impossible give stability of all of device. Epocha de Ilizarov, first this is wire tensioner construct Ilizarov, but he usually use wrenches. I prefer this device because I can control any wires, any forces of tensioner. This is standard wire tensioner, but I prefer dynamometric tensioner. And remember about segment, about child, about condition of bones. And usually we use between 70 to 100 10 kilo, and osteoporotic, and this is depend of what we use, full ring or half ring. And Ilizarov fixator, this is medullary apparatus, unlimited configuration, powerful biological tool, histogenesis of bone, muscles, nerves, and skin, transformation of pathological state such as osteomyelitis and pseudoarthritis into normal bone. So many variants. Impossible make second surgery with same variant of device. All of body we can use for fixator and for treatment. With fracture with many segments like this woman, femur, patella, tibia, another femur, pelvis, and during this treatment, patient can use both of extremities, can walk. Many pathological and difficult situation, deformities, shortening, after trauma, after surgery, foot problem we can solve, remove with Ilizarov. Same situation with hand. And I won't repeat again, Ilizarov apparatus, this is not device, this is set, many sets, many details, and you can create new device, and we wait you. And Ilizarov apparatus give us chance go to do inside of Ilizarov methods. Ilizarov apparatus not same the Ilizarov methods, because sometimes doctor use Ilizarov frame but not follow another rule, another instruction of Ilizarov. Ilizarov possible from bamboo if doctor follow this first fixation of bone, firm fixation of bone fragment, almost bloodless surgery, early weight bearing of the affected limb, function of the adjustment joints, postoperative adjustment of the bone fragments from the time of surgery till the removal of the fragments. We can management of these fragments. And if doctor follow this instruction, this is methods of magic methods of treatment. And Ilizarov simply taught us to drive an orthopedic car. And many years ago, he was simple doctor. Now we talk about icona, about planet. I want to repeat a few words from some doctor from all of the world. The way of victory is having fight on beliefs and ambitions of find. And you open door in this point, you will find a key known as Ilizarov. This is some team from Tehran. And this doctor with big experience, more than 20 years, he worked like any orthopedic surgeon in the world. Then he came to the Kurgan, and after that, he used only external Ilizarov fixator. And this is, he said, Ilizarov feel any defect of life of bone. When you are helpless in orthopedics treatment, think to Ilizarov. Extending the quality of life by Ilizarov lengthening. When all lens are off, lights are off. The lights of Ilizarov is on. Surprising, unbelievable, even by Ilizarov. The end of disability by Ilizarov. Bright future in disability by Ilizarov. Very good word about him. Barry, this is special for you. great men from all over the world, Professor Shevtsov, Professor Bari, Professor Salomin, and me. And I invite all of you, come here, because from this place you will get big, powerful for thinking, for active, for change your life. Thank you very much. And I invite you, all of you, for cooperation and exchange of our experience. Thank you.
Thank you. Thank you very much for your excellent presentation, sir. Now, I would like to request our honorable expert panel, Professor Mofakrul Bari, sir, to share his knowledge regarding the ABC of osteosynthesis by Ilizarov. What we can do in initial stage. Sir, would you please share your knowledge with us, please? Professor Mofakrul Bari, sir.
Thank you very much, Konstantin Igorovich Novikov. You nicely explained everything. Everything. I am impressed by your slides and the way you explained everything. That is fantastic, fantastic. And if you have any slides for how to pass the wires, safe corridor, you have that one, or you could not make that one?
Yeah. I for 10-15 minutes I have.
You have. Then Tanveer, he could show the safe corridor, how to pass the wire. Then I can talk, because we have time.
Yes.
Yes.
During,
Okay.
Yes, definitely.
I tried during 10-15 minutes finished. Okay.
Okay, 10 minutes. You talk about that one. Okay,
Okay,
that
sir.
will be good.
And
Okay.
surgery is surgery, and everything is good. I can start.
Yes,
Yes,
yes.
sir, you can start.
And again, this year, 100 years for this magic perfect man, 70 years for his frame, and 50 years for our center in our small Russian village. Great man. And I want to repeat again, Ilizarov methods: bloodless, firm fixation, bone fragments, early weight bearing, function of adjustment joints, and possibilities
Screen.
to. Pardon?
Sir, you have to share your screen, sir.
Where is the screen? We don't see the screen. Picture.
No?
No, sir.
Just a moment. Just a moment. Вот где-то опять вправо здесь было. Now?
No, sir, yet not.
Вот этот. Нет, вот этот. Мгм. Может быть, один закрыть? Ты этот закрой. Very sorry. Давай. You can see?
Yes.
So we hope so. Yeah, we can see. The method of
Very
Ilizarov is.
And when we start thinking about surgery, so many informations coming in our brain, and great surgeon help us with his opinions. We usually use Atlas Maurizio Catani, very good, very excellent surgeon from Italy. But in Russia, in Bangladesh, we need to think about nerves, vessels, skins, joints, tendons, and then we need to think about final construction. So many atlas in the world we have, and general consideration: start on site, containing critical structures. Any segment, any part of segment. And when we pass wire, first remember about ABC. Push wire through soft tissue by hand, then through the bone, drilling. Go out of second cortex again, go through the soft tissue without drill. Pass the wire through muscles, tendon, and think about transfixation of muscles. And check joints during the passing. And for any doctor, better start from tibia, because this is a good segment for education, for experience. And if we talk about different age of patient, remember about grow line and go away from interest of joint. Some doctor delayed safe zones of tibia to the 3 part, some doctor to the 7 part, but usually we talk about 3 parts of proximal, middle, and third part, distal part of tibia. Structure of risk, common peroneal nerve, popliteal artery and tibial nerves, saphenous nerves. Here, everything clear you can see. And atlas is atlas, any library, books is books, but go to the surgery with experienced doctor. Go and like assistant to do many surgeries, then again with experienced doctor go for your insurance, because if something wrong, experienced doctor will immediately support you. And depend of surgeon, when you pass wire, remember about safe zone. Some doctor pass all of wire, then start construction. I prefer another way. Pass wire, for example, on proximal part, then apply of frame. This part of tibia we can put or half ring, and after surgery, patient can use on his knee joint. And proximal tibia, you can use crossing wire, Kirchner wire. If half pin, please remember about artery and nerves, popliteal vessels, and now go through the second cortex. Very seldom we use second area of cutting. This is near 7-8 centimeters below the knee joint, and this area we use only we have apex of deformity. Mid zone, very good area for half oblique wires or half pin. I am very seldom use half pin pins of chance. Here with Dr. Barry, usually we use elastic oblique half wire, and this is give us possibilities very good increase stability of frame. And you can see better if we will not touch big zone of soft tissue of muscles. Clear mid area of tibia. Very seldom we have problem with risk structure. And doctors from all over the world prefer half pin, pins of chance. In Russia, very seldom. Fourth and fifth cut only if we have deformity. In trauma, in orthopedic case, we usually use distal part of tibia, and must be fixed both of bone together, because must think about distal syndesmosis. And when you pass wire, please think about range of motion of ankle joint. Doesn't matter how many frames. When you have proximal and distal frame, then you start think about how many frames you need. Add more additional rings. But in orthopedic case, we usually put 2 or 3. This is depend of case, for lengthening or for deformity. For foot, we divide to the 3 part, 0, 1, and 2. Only on calcaneus we have risk of structure. Remember this picture. And when you pass wire, better before palpation with your finger and find where arteria, posterior tibial artery. Usually we use 2 wires, and sometimes this is depend of situation. We pass 1 parallel wire through talus. Mid part of metatarsal, we use 1 or 2 wires, and end of metatarsal, we usually use 2 wires. On femur, very careful on proximal and mid area, because when we use wire on the proximal part, this is difficult for patient. This is high risky for surgeon, and we insert very big area of muscles. And on the proximal part, in Russia, in my experience, just now, I am not prefer, I am use chance pins, half pins. This gives us chance use with different directions and different level. This area very seldom we use. We pass wire. This area very common. And here. And now coming time when pass, we start use half pins here, because for big lengthening, 4 wires in this area give us little bit problems with lengthening, and we lost functions of knee joint. But this is a photo from Epoca de Ilizarov. Very close to knee joint. During the surgery, surgeon check function of knee joint, and we use big arch on the proximal femur. And after surgery, after 12 centimeters of lengthening, patient use only sticks and go up and down by stairs, and never use elevator. Remember about range motion of knee joint. And summary, know your cross-sectional anatomy and safe zone. And before surgery, take the book. During the surgery, stay near with experienced doctor. A well-constructed frame reduce complications and increasing patients' tolerance, use wire and half pin. And surgical treatment by Ilizarov improves the quality of life of our patients. And remember, after patient, Ilizarov opens the world, and your patient can open your name for the world. Just now, Ilizarov, this is monument, this is planet in the sky, this is our philosophy, this is our future, this is our past. Thank you very much for your attention, for your time.
Thank you very much. I think it is the most precious one for the young surgeons, and thank you, sir, for showing us the safe zone and very important slides for the surgeons. Now, I would like to request Professor Mufakhar Barisar. Sir, would you like to add something special with these slides?
Excellent presentation, and slide was very nice. Konstantin Igorovich, I am very much happy that our young orthopedic surgeons learned a lot of things from your deliberation, and you rightly showed how to apply the wires, topography, anatomy. Before applying the Ilizarov apparatus, you must learn, and you must learn the use of every apparatus of the Ilizarov methodology. And since my residency till today, I am doing a lot of Ilizarov surgery. If you follow the principle and the philosophy of Ilizarov, you can get a fantastic result. You should have to love the apparatus, you should love the technology. Starting from head to toes, you can apply properly Ilizarov. And unfortunately, a lot of young orthopedic surgeons, they don't want to learn meticulously the basic Ilizarov and the advanced Ilizarov. And you rightly mentioned, Professor Novikov, you rightly mentioned, you start any orthopedic surgeon, I tell you, whenever Ilizarov is in my hand, I feel most of the time comfort, not discomfort. Start with the tibia. It's very easy to apply tibia, upper third, middle third, lower third, any kind of deformity, any kind of trauma in the tibia. When you gain experience, lot of experience, you can start with the femur. And then you can start with the humerus. You're going to start with the radius and ulna. You're going to start with the pelvis. You're going to start with the foot. So Professor Novikov showed how to apply the different, you see, one man with polytrauma. You can apply that I am doing in the femur, in the tibia, in the patella, at the same time, the right radius and ulna, in the humerus. Only you should have to know the principle and proper tension of the wires. This is very important. From 70 to 110, 120, even 30, you should have to apply the tension. Around the ring, proper tension. And you should have to check the ring every day wherever your apparatus is stable or unstable. Apparatus must be stable. Professor Shevtsov was always telling me, Ilizarov apparatus is just like an aeroplane. If your one nut and bolts or rods is loose, then there will be painful pain in the limb, and patient will complain with doctor pain. That's why you should have to check. Every day you should have to check, and you teach your patient how to check the nuts and bolts. And if you do that, you can have a very good prognosis, good result. So thank you very much, Novikov, for joining us and having a very good
I have excellent experience from your country. I am very happy because I saw so many doctors who follow our philosophy, our methods. And like Professor Shevtsov says, our frame like aeroplane, but after any flight, you need to check again all of как самолет? Я забыл.
Yes, some aeroplane.
Aeroplane, yeah, must be checked.
Check.
And,
So unfortunately, yes, unfortunately, a lot of the young, even bending of the wires, very beautiful. Whenever you don't bend the wires, you don't use the rubber stopper, it looks ugly. You cannot open without applying the rubber stopper. Bending wires, it will destroy your cloths. There is a beautiful way how to bend the wires. Whenever you touch your hand, the wires, you will not feel anything. It will not destroy your cloths. Even the skin
colleagues, young doctor, any doctor, if you start use Ilizarov technique, please little bit think, because you cannot live from patient. Just now, so many different techniques, Western techniques, very quickly. In operation theater, surgeon has first result. After a few days, patients discharged from hospital, and then surgeon never in contact with this patient, because coming in other area, next, money is honey, and doctor not think about patient. If you touch patient and if you start treat patient with Ilizarov frame, you must be think many months. This is will like your parents. You cannot live. You each day need touch his leg, his frame, and this situation when you feel any difficulties during the treatment, give you possibilities get excellent, perfect result. 40
Again,
years.
I want to add a little. We have time, 2 or 3 minutes, 5 minutes?
Yes, sir, definitely.
I want to add with this. Ilizarov apparatus for trauma, open trauma and deformities. No other apparatus like Ilizarov, no. In any deformity, congenital and acquired, it is multi-axial. It is not uniaxial. It's a multi-axial. You can correct any kind of deformity with this apparatus by using only wires. I never use any kind of pins in the tibia. This is the Russian teaching. I always tell them, why you are using biocompatible thin wires, 1.5, 1.8. In the tibia, you can use very fantastically, you can use. And the fundamental principle of Ilizarov methodology is load and motion.
And if we have time, doctor, I want to ask, do you know about case when chance pins broken on the tibia? I try 4 or 5 patients I have, and all of these patients has situation with broken chance. Why? Because during our weight bearing, our bone bent, and how I can say breathe. Wires give chance and possibilities for bone during the weight bearing breathe. Chance have been very rigid and not give these possibilities.
Yes. Not flexible.
Not flexible. You're absolutely right, Dr. Barry. Thank you very much for these possibilities. We'll be with you, with many great doctors from Bangladesh, and I hope we have a good future for consideration.
Definitely. So thank you very much. Thank you very much. Thank you, Professor Novikov sir, and thank you, Professor Mofakrul Bari sir, for sharing your knowledge with us. And I would like to thank Raj TV for arranging this type of program, and definitely Renato Pharmaceuticals Limited for sponsoring our program. Dear viewers, hope you will be with us in the next Friday with another magical topic of Ilizarov. Until then, I would like to say bye-bye to.
Thank you.
Have a nice day. Bye-bye.
Thank you. Bye-bye. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.